Hi, Dr. Payne here with Men's Health 101. Today, what I'm going to do my 5-minute video on is prostate cancer and the prevalence among men. So I'm going to start off with the statistics and just dive right in here because we only have 5 minutes. So I have a list of things that I want to read to you, and I made the list because it's just so much to know about prostate cancer. It is the number one cancer found among men, and the most prevalent. And it says about 30 million men suffer from prostate conditions. So that could mean prostate inflammation, hypertrophy of the prostate, where the prostate size increases. It also can mean the prostate cancer. So it is the second leading cancer killer in men behind lung cancer. So this is a very important topic that needs to be discussed and brought to awareness, especially for men. So let's talk about some of the risk factors that's associated with prostate cancer. So it's not very common for you to be 40 years old or younger to get it, but it has happened. Usually it's over 50 years of age. And more specifically, it's between 55 and 69 years old where you need to start to be screened. I think you need to be screened in your 40s. That's my personal opinion. But it is recommended that it's 55 to 69. Some of the risk factors, okay? So, African Americans and Caribbean men with African ancestry tend to have a higher prevalence of prostate cancer. If you smoke, if your diet is horrible, okay, that's a whole nother subject. But diet, smoking, history of prostatitis, which means inflammation of the prostate. That can happen for a whole number of reasons, including an infection or an STD. If you, especially in that age group, and probably a little bit older, being that the Vietnam War happened so long ago, but if you had chemical exposure to Agent Orange, that increases your risk factors. 6 out of 10 cases are found in men older than 65 years of old. And if you've had a vasectomy, it increases your risk some, not terribly, but they are finding that increases your risk of inflammation of the prostate as well. Now, let's move on with the screening. So there's a couple of screenings that medical doctors will do, and it's from preliminary tests to advanced tests to the diagnosis of prostate cancer. So I'm going to take you through that. So first, most men already know that there's a digital rectal exam, okay? That's basically using the fingers. And so the doctor will have a gloved finger and go through the rectum to feel for any lumps or anything that feels unusual around the prostate. So that's usually first. Then, if something feels unusual or you fall within that age group, then the doctor will do a blood test. And that blood test is called a PSA. That's called a prostate-specific antigen. I talked a little bit about that on my introductory men's health video. It is very important that your doctor is the one that orders that test because your doctor will have your medical history, number one. Your doctor will know what medications you are on. Some medications, some medical procedures, a history of enlarged prostate can cause your PSA levels to increase. Usually they like the PSA levels to be below 4. Anything higher than that, then they move on to the next test. The next test is a biopsy, where they go in and take a piece of the tissue of the prostate, look at it under a microscope, and see if those cells have changed into a cancerous type cell. From then, they may do a sonogram, which is a type of ultrasound that uses waves that bounce off of the tissue of the prostate, turns that into a digital picture for the doctor, and it's usually done under MRI guidance to make sure that they're doing the sonogram in the proper place. So that's usually the whole process to get to that point for diagnosis for prostate cancer. Now, you may be asking, okay, so tell me the signs and symptoms so I can be alerted just in case. Now, as we all know, our bodies tell us what's going on. And sometimes you don't know what's going on, right? Because like I said before, you only feel about 20% of what's going on in your body. So this is why it's so important for you to get screened. So here are the most common signs and symptoms associated with prostate cancer. So if you have frequent urination, okay, and that's putting aside if you have diabetes or overactive kidney or bladder issues, but just alone frequent urination, weak or interrupted urine flow, or the need to strain in order to empty your bladder. That usually means your prostate is enlarged. The urge to urinate frequently at night. Also, if you have blood in the urine or in seminal fluid, that could also be a sign or symptom. A symptom. If you have new onset, out of nowhere, of erectile dysfunction, you need to go to your doctor and make sure nothing else is going on. Also, if you have pain or burning during urination, and also discomfort while sitting due to an enlarged prostate. Okay, now, if the prostate cancer has developed in your prostate and it is starting to spread and you don't know it, some of the symptoms that you may have would be pain in the back, hips, thighs, shoulders, or just bones, just a deep pain. Also, if you have swelling built up in the legs or feet. Unexplained weight loss is usually the number one of the symptoms or signs rather of some kind of cancer going on. Doesn't mean you have it, but that's usually a red flag. And then unexplained fatigue, right? So those are the main factors when it comes to prostate cancer. I want you to remember to get screened, especially if you're 50 or older. Okay? Now, what I want you to do is tag someone below. If you think they can benefit from this information, go ahead and tag them or share this video. Secondly, if you feel like they could use some type of chart that has all the conditions that are especially common among men, what age to be screened and what the screenings are, so that you can use it as a guide, you can private message me or comment below, and I'll be sure to send that to your loved one or friend. Thank you so much.